The Ministry of Health and Family Welfare on November 21st unveiled the National Suicide Prevention Strategy. It's a first of its kind policy formulated by the government to prevent suicides as a public health priority. What is India's National Suicide Prevention Strategy? According to the ministry, the policy will set the stage for the promotion of mental health and the prevention of suicides in the coming decade. The goal is to reduce suicide mortality in the country by 10% by 2023. Now, the strategy provides a framework for multiple stakeholders to implement activities for the prevention of suicides in India. And there are four main objectives. First, it seeks to establish effective surveillance mechanisms for suicide within the next 3 years. Second, it seeks to establish psychiatric outpatient departments that will provide suicide prevention services through the district mental health program in all districts within the next 5 years. Third, it aims to integrate a mental well-being curriculum in all educational institutions within the next 8 years. The fourth objective of the National Suicide Prevention Strategy is to strengthen surveillance of suicide and further generation of evidence through evaluation, which will ensure improvement in the program quality. There are 5 key stakeholders responsible for realizing the objectives. These include national-level ministerial stakeholders, state-level governmental stakeholders, district-level governmental stakeholders, NIMHANS Bangalore, and other top mental health institutes and strategic collaborators. So let's take a look at the current scenario in India. According to the annual report of the NCRB, National Crime Records Bureau, released in August, 1.64 lakh people died by suicide in 2021. Now, this is an increase of 7.2% from 2020. The NCRB report also stated that more than 100,000 people die by suicide in the country every year. A total of 25,891 suicides were reported in the 53 megacities of the country in 2021, with the highest in Delhi. Most suicides in India are by youth and middle-aged adults. Data shows 65% of the suicides in 2020 were reported in the age group of 18 to 45 years. Ongoing suicide prevention initiatives in India includes the National Mental Health Policy 2014, which sees prevention of mental disorders, reduction of suicide, and attempted suicide as core priority areas. The Mental Healthcare Act 2017 brought in some necessary changes. The act that came into force in 2018 effectively decriminalized attempted suicide, which was punishable under Section 309 of IPC. It ensured that individuals who have attempted suicide are offered opportunities for rehabilitation from the government as opposed to being tried or punished. Several national programs such as the National Mental Health Program, Ayushman Bharat, and Nasha Mukti Abhiyan Task Force are also in place.